Why BRFSS? Because if you're trying to improve community nutrition, you need to know what people are actually doing, at scale. The Behavioral Risk Factor Surveillance System, BRFSS, is the CDC's giant listening post for adult health behaviors in the US. It's the largest, continuously conducted health survey in the world, running since 1984. Here's how it works. Every month, trained interviewers call a random sample of adults in every state, using random digit dialing for both landlines and cell phones. If you're 18 or older and live in a household, you could get picked. They follow a standardized questionnaire with 3 parts. 1. Core questions everyone gets nationwide. 2. Optional modules, states, can choose to get additional information. For example, sugar-sweetened beverage intake, food insecurity, breastfeeding. 3. States can also add their own specific questions to address local priorities. Interviews are done with computer-assisted systems, so questions and wording are consistent. After data collection, the CDC applies complex statistical models to account for the sampling design, non-response, and demographics, so results represent each state's adult population. What do they ask? Think behaviors linked to chronic disease, fruit and vegetable intake, sugary drink consumption, physical activity and weight status, tobacco use, alcohol use, chronic conditions like diabetes and hypertension, preventive care, demographics, and social determinants of health. Why should a community nutrition student care? Because BRFSS gives you state and often local estimates to aim your work. Use it to track conditions like obesity and type 2 diabetes prevalence over time. Identify groups with low fruit and vegetable intake. Identify groups with high soda consumption. Track changes in physical activity levels. This data can be used to evaluate programs by comparing trends before and after rollouts. Data can also be used to support grants and policy proposals with credible information. Want a quick example? I'm planning a campus-wide community campaign to cut sugary drink intake. I pull BRFSS prevalence data for obesity and diabetes. I add the optional sugar-sweetened beverage data, if available. I organize the data by age, income, and education. If young adults in my state have high SSB intake and low preventive care, I've got a target, a message, and baseline numbers to measure change. Access is easy. Use BRFSS, Prevalence and Trends. Data online tools for quick charts and maps. Smart BRFSS for selected metro and county-level data. So what are the limitations of BRFSS? It's self-reported, so expect recall and social desirability bias. It excludes people in institutions. Response rates vary by state, and it's cross-sectional. Great for observing patterns and correlations. Bottom line, BRFSS is your reality check. It tells you who needs help, where, and with what behaviors, so your nutrition interventions are targeted, defendable, and measurable. If you're planning your next project, start with BRFSS. Let the data show you where to push and how to prove it worked.